Hello viewers. Composition. Each gram of oral paste contains 50 mg of amlexanexin. Pharmacology. The mechanism of action by which amlexanex accelerates healing of aphthous ulcers is unknown. In vitro studies have demonstrated amlexanex to be a potent inhibitor of the formation and release of inflammatory mediators histamine and leukotrienes from mast cells, neutrophils and mononuclear cells. Given orally to animals, amlexanex has demonstrated anti-allergic and anti-inflammatory activities and has been shown to suppress both immediate and delayed type hypersensitivity reactions. The relevance of these activities of amlexanex to its effects on aphthous ulcers has not been established. After a single oral application of 100 mg of paste, 5 mg amlexanex, maximal serum levels are observed at 2.4 hours. Most of the systemic absorption of amlexanex is via the gastrointestinal tract, and the amount absorbed directly through the active ulcer is not a significant portion of the applied dose. The half-life for elimination was 1.1 hours in healthy individuals. Indications for the treatment of aphthous ulcers. Dosage administration. Apply the paste as soon as possible after noticing the symptoms of an aphthous ulcer. Continue to use the paste 4 times daily, preferably following oral hygiene after breakfast, lunch, dinner, and at bedtime. Dry the ulcers by gently patting it with a soft, clean cloth. Wash hands before applying. Moisten the tip of the index finger. Squeeze a dab of paste approximately 1/4 inch 0.5 centimeters onto a fingertip. Gently dab the paste onto the ulcer. Repeat the process if more than one ulcer are present. Wash hands after application. Wash eyes promptly if they should come in contact with the paste. Use the paste until the ulcer heals. If significant healing or pain relief has not occurred in 10 days, consultation with a physician is required. Adverse effects. Adverse reactions reported by 1 to 2% of patients were transient pain, stinging and/or burning at the site of application. Infrequent, less than 1%. Adverse reactions in the clinical studies were contact mucositis, nausea, and diarrhea. Contraindication. Amlexanex oral paste is contraindicated in patients with known hypersensitivity to amlexanex or other ingredients in the formulation. Precaution warning. Wash hands immediately after applying amlexanex oral paste directly to ulcers with the fingertips. In the event that a rash or contact mucositis occurs, discontinue use. Use in special population. Pregnancy. U.S. FDA pregnancy category B teratology studies were performed with animals at doses up to 200 and 600 times, respectively, the projected human daily dose. No adverse fetal effects were observed. There are no adequate and well-controlled studies in pregnant women. Because animal reproduction studies are not always predictive of human response, this drug should be used during pregnancy only if clearly needed. Nursing mothers' amlexanex was found in the milk of lactating rats. Therefore, caution should be exercised when administering amlexanex oral paste to a nursing woman. Pediatric use. Safety and effectiveness of amlexanex oral paste in pediatric patients have not been established. Overdose. Ingestion of a full tube of 5 grams of paste would result in systemic exposure well below the maximum non-toxic dose of amlexanex.